Hi, welcome to acceptwellness.com. I'm Jokura, naturopathic doctor and clinic director of Accept Wellness. Today I'd like to speak to you about sleep and babies. Now, there's that saying, to sleep like a baby, and if you are a new parent or have witnessed new parents, certainly there are some babies who have that wonderful ability to sleep as long as they need. But for the rest of the young children out there, sleep is actually something that needs to be nurtured and essentially taught. We, as caregivers, need to provide that foundation and the parameters to allow for high quality sleep when the child needs, and to nurture certain routines. So at different stages of a baby's development are going to come different issues and different optimal sleep patterns. In the first few weeks after birth, there's often a big adjustment to life outside the womb, and for the day and night distinction to occur. That happens automatically with some children and sometimes not with others, where you have a very wakeful child, wakeful baby during the night, when ideally they should be having longer periods of sleep. Of course, you are working with their cues and feeding on demand likely, so the first few weeks are not quite so routine. But as they get older, they develop a greater capacity for that routine, and they actually crave it. And it's the caregivers, it's the parents' jobs to set up the parameters to allow for that as much as possible. Now, if you do have a fussy baby who is not able to sleep very well, it could be a sign that something is out of balance. We definitely want to rule out that there isn't anything serious going on. So please, if you have any concerns, you must talk to your primary caregiver, whether that be your naturopathic doctor or medical doctor, someone who is involved intimately in the care of your child. There could be structural things after birth. There could be molding of the head where the skull bones haven't reverted back to normal, so there could be restrictions. So that kind of thing can be helped sometimes by craniosacral therapy, a gentle hands-on technique, which I'll discuss in a future video or another video. You want to make sure that digestively they don't have any concerns with malabsorption or significant reflux, which could indicate in some rare, but something like a hernia. So you do want to investigate that nothing physiologically is going wrong there. So once that's been established and you think, well, it's just, there's just no rhyme or reason, there's no pattern, we would work together on really understanding what sleepy cues are and the timing of when you should start to wind things down, and having the room dark and quiet. For some children, they do need those cues, those external cues, to help them calm down. And really, one of the biggest things that I do see in my practice is that parents put their child to bed, let's say at 8 or 9, thinking that that's an early bedtime, and it certainly would be an early bedtime for adults, but for babies, they actually sleep for most of the day, so that in fact might be a bit late for your child. And we would discuss what an optimum bedtime would look like. And once that nighttime routine and that nighttime sleep quality improves, meaning they're able to sleep for longer stretches, and by long stretches we might be talking anywhere from 3 to 5 hours in those early months. We're not talking necessarily 12-hour stretches yet. So we would work on that together. And then the daytime sleeps, the nap times, you know, how often are they napping? How often do you think they should be napping? What are some of the cues that you've picked up on to indicate that they need sleep? And what are some cues that you might have missed to indicate that we should really be working on winding that down? So once nighttime sleep improves, often daytime sleep will improve. Not always. Sometimes there are different things that we need to look at for nap time sleep. So in total, you know, I get asked a lot, what's the ideal, how many hours should my baby be sleeping? And like everyone and every question, I usually have to say, well, that's really individual. There is a range out there. You know, you'll see ranges as low as 14 hours total sleep during the day to 18 hours a day. So your child will fit in somewhere in that. But you do want, when they are awake, for them to be alert, for them to be engaged with you, to generally have a happy mood, a good disposition. And then when they do sleep, you want them to really have that good quality sleep. So that's it for now. I wanted to keep it short, but if you have any further questions, I invite you to email us or give us a call. All our contact information is on the website, www.acceptwellness.com. I look forward to seeing you soon. Thank you.